Vivek Gupta, Senior Cardiologist, Delhi Apollo Hospital, along with Dr. Rekha Mishra in Apollo Hospital, Delhi. We are doing a follow-up echocardiography of a patient who received transcatheter aortic valve implantation, which is a non-surgical technique done by Alan Crevier in 2002. I worked with him long time ago when the process planning was being done. It is a very important case, and we have done this procedure of Edward sapien valve about 2 weeks back. So I'm going to actually show you the pictures of the echo, and we can see the gradient is 13 and 17, and she has found out the valve area. This is the gradient. So valve area of 2.55 centimeters square. Perfect, very nice. This is from the continuity equation. Can you describe yourself?
It is by continuity equation.
Uh-huh.
We calculate the gradient across the aortic valve and calculate the stroke volume through LVOT. Then we divide it by the gradient, the VTI of the aortic valve. So we can calculate by continuity equation.
So the peak gradient is 13, mean gradient is 7, and the calculated valve area is 2.55 centimeters square. So this patient is very lucky that the Edward sapien valve has done very good work, and this valve is now almost like a natural valve with a tricuspid leaflet and bovine pericardium. And we thank Dr. Rekha Mishra, but also we thank Dr. Alan Crevier to have such innovation done 22 years back when I was working with him 1996 to 98. At that time, it was in his hypothesis. He was planning, he was finding a company, he was making the prototype through the Israel company, and then he made a company, and then finally it was done in the patient which I want to describe with you, Dr. Rekha, you might not be aware. That was the first patient, was 57-year-old only, bicuspid aortic valve, severe aortic stenosis, cardiogenic shock, no femoral pulses, post-bypass patient, ejection fraction of 25%. That was the first patient which was done by Dr. Crevier. 25% ejection fraction, post-bypass, no femoral pulses. Finally, he had to go through the femoral vein, transseptal antegrade route, so retrograde route. Femoral vein, right atrium, right atrium, transseptal puncture, left atrium, left ventricle, and then going to the aorta, reverse direction. So this was the beautiful case. The first case was most complex case done by Dr. Crevier. I think we should give a hats off to him who did such a case. Now we are doing a simple antegrade approach, which is more simple to the femoral artery, going into the ascending aorta and then deploying to the aortic valve. So congratulations once again to Mr. Ajit, who has received a fantastic valve, and we have done a very good job. Thank you very much, Dr. Team, Dr. Chaitanya Gupta, Dr. Rekha Mishra, and the Apollo Hospital team who has done a good job. Thank you very much. Bye-bye. 14 September 2025. Bye-bye.